And today we're going to talk about questions to ask your doctor about opioid prescriptions. Opioids are often prescribed after surgery or for chronic pain, but can be addictive. Some people have an opioid use disorder started with a prescription for an opioid medication from a doctor to help with post-surgical recovery or other causes of chronic pain and had some concerns. Opioids can play an active role in your care by asking your doctor questions about prescription medications, including opioids. This discussion will help you determine if opioids are the best option to address your needs or if other options exist that will have less side effects and decreased potential for addiction. We are going to talk with Ashley Yager, Gabrielle Mersa, and Maren Roy-Voss today, who are part of our HEART initiative. And we have some questions we're going to have them answer.
Thanks, Tim. Some questions that you can ask your doctor about an opioid prescription are: one, why do I need this medication? And what are the alternatives to using an opioid prescription? Can I do other things to manage my pain without taking a prescription? Number two, how long should I take this medication or plan on taking this medication? What are some of the potential side effects of taking this medication? Your personal or family history of substance use disorder, you might want to talk about that with your doctor, as well as any plans to taper off or stop taking the medication in the future. Some other questions that you might want to ask your doctor, Gabby will talk about next.
Thanks. So another question you could ask is, could this medication interact with anything else I'm taking? For example, if you're taking any medications for anxiety or for sleep or seizures, they might interact with opioid prescriptions. You can also ask if you can have a prescription for naloxone. Naloxone is a medication that helps reverse an overdose due to opioids, and it's always good to be able to carry some with you in the event, since you might be taking a prescription opioid. There are also trainings if you do not know how to administer naloxone. There are trainings available through Utah State University Extension. Local health departments also provide this training, and you can also access from the Tribal and Rural Opioid Initiative that provides trainings in the Uinta Basin specifically, that is available for tribal and rural communities. You can access them that way. And then Maren is going to offer up some more questions that you can ask.
So just like you can ask about naloxone to make sure that you are able to stay safe while using an opioid prescription, there's a few other questions you can ask your doctor to make sure that we stay safe. And one is, how should I store the medication? So there might be ways to store the medication that can reduce the potential of others borrowing, taking, or misusing that medication, as well as the things about keeping it dry and at the right temperature. You can also ask your doctor about what should I do with unused opioid medication. So because of its addictive potential, we want to safely dispose of the medication after we're done using it for our medical needs. So there's a lot of options your doctor can tell you about locally. There are medication disposal boxes. A lot of times they're at a police station or at other locations. There also tend to be these local drug take-back events that the Drug Enforcement Agency tends to sponsor, and our local law enforcement and get involved. They happen 1 or 2 times a year, and so your doctor might know about those. And then there's some little packets you can mix in to safely dispose of the medication. Sometimes it's called Dispose RX, that might be available for free at your health department or your doctor's office. As well as other information on how some other techniques for safely disposing of the medication. So those are all options, and your doctor should know about those, and you can ask those questions as well.
The USU HEART initiative also encourages you to go check out a handy checklist online the FDA has available, which you'll see available here in our reference list. But we also encourage you to use opioids safely. Medication prescribed by your physician, something we know can be helpful for those that have that need. Don't be afraid of them, but use them correctly with your physician's direction, as well as your pharmacist's direction if necessary. HEART Initiative encourages you to look for all of our links here, Facebook, tweet, all of those things. Follow us. We encourage you to stay healthy, and we hope you enjoyed this Heart Punch video and have a great day.